Hey everyone, welcome back to Perinatal Pelvic Health Solutions, where we dive into postpartum recovery and how to take care of your body after having a baby. I'm Dr. Ryan Bailey, a pelvic floor physical therapist specializing in pregnancy and postpartum. Today, I'm going to be talking about a super important topic that every new mom should know: lifting after giving birth. Because lifting is part of your everyday, we'll cover why limiting your lifting in those early weeks is crucial, how to gradually progress for a smoother recovery, and how to assess your body's readiness for lifting. Let's get into it. First up, let's talk about why it's important to limit lifting in the early weeks after childbirth. Your body has just gone through an incredible journey, and the tissues in your pelvic floor and abdomen are in delicate state as they begin to heal. When you lift heavy objects too soon, you put unnecessary strain on these healing tissues, which can lead to complications like prolapse, incontinence, diastasis recti, and delayed recovery. During the first 6 weeks, your body is working hard to repair itself. Limiting lifting during this period helps ensure that the tissue healing process isn't disrupted. Think of it as giving your body the best possible start for a full recovery. This isn't just about being cautious. It's about building strength and endurance in a way that supports your healing. Start with light objects. Think of lifting your baby or a small baby bag. As the weeks go on, you can gradually increase the weight you are lifting, always paying attention to how your body feels. This gradual approach helps you build strength safely and reduces the risk of injury or setbacks. And since it's not always possible to avoid heavier objects after giving birth, especially if you have older children, there are a few signs to look out for. First, check in with your core. Are you able to engage your core muscles in standing without pain or discomfort? If your abdomen still feels weak or unstable, it's a sign you need to hold off on heavier lifting. That would look something like this. Inhale, expand your ribs, relax and soften the pelvic floor. As you exhale, close the pelvic floor holes, lift and zip up through the abdominals. From the side, it would look like this. Next, try doing a simple squat. If you can do this without feeling any pressure or pulling in your pelvic floor, you can add baby or no more than 10 pounds to reassess your pelvic floor's response. And since you will be lifting your baby repeatedly throughout the day, you want to check the response multiple times in a row. And if anything feels off, it's better to take a step back to check your form and speed of execution. Of course, you can't be perfect in your form all of the time. Functional lifting is usually spontaneous, but the more you practice and are mindful, your body will build strength and endurance around the new patterns, allowing you to increase weight and continue your recovery safely. There are 4 lifting techniques you can choose from: the hip hinge, squat, lunge, or golfer's lift. Each requires a different set of muscle patterns and strength, which may not be available in early postpartum. For example, a lunge lift, yet beneficial, is much more awkward lift, requires increased pelvic core stability to help the pelvis from twisting, which may lead to pelvic pain. A hip hinge and golfer's lift require more spine involvement and abdominal and glute strength for stability of your back. I tend to see more back pain in my patients who use this strategy more frequently. However, a squat lift, which may seem overkill for picking up your baby or lighter objects, allows your body to harness your leg strength to assist your recovering pelvic floor. Let's practice it now. Let's start with putting your feet hip width apart with even weight distribution. Inhale to lower to a comfortable height. Of course, this is going to change when it's in more of a functional way, but as if you were sitting in a chair to help your pelvis stay in a neutral position. At the same time, you want to make sure that your ribs are staying over your pelvis and not flaring in the front. Then you're going to exhale and engage your core as demonstrated earlier by closing and zipping up to get the object or your baby. You may need to inhale again before standing up with an exhale. Now, this is just practice, and you won't always be able to do that immediately after having a baby before you have to lift your baby. But now you know what to look for when you are lifting your baby or other lighter objects to make sure that your pelvic floor and your abdominals that are healing and recovering aren't put under undue stress and strain so that you don't derail your recovery. Give this a try. Let me know how it goes in the comments. And if you found this helpful, let me know by following Perinatal Pelvic Health Solutions.